Let's talk a little bit about acne scar management. First of all, why is acne scar? We all know that acne is an inflammatory skin condition. So this inflammation occurs at different levels of the skin, depending upon which the scars can occur at different levels of the skin. Especially if acne is not treated at the right time, and if there are certain habits like picking on the acne which can increase the inflammation, scars will invariably occur. So depending upon the depth of the inflammation, there are different types of acne scars that can occur. The acne scars can just remain back as small brown or blackish spots. They can be shallow macular scars. They can be deep pinpoint ice prick scars. They can be larger box scars which can go to the deeper levels of the skin, the deep dermis, and they can also be shallow rolling scars. Best is to treat the acne properly at the appropriate point of time and prevent scars. But if scars do occur, there are various modalities of treatment for different types of acne scars. If there are only brown spots or dark marks of acne left behind, it is called as post-inflammatory hyperpigmentation. Topical agents can help along with a good use of sunscreen and skincare regime, but they take a lot of time to subside. So, superficial procedures which affect the upper layers of skin like microdermabrasion and chemical peels, especially those having glycolic acid, salicylic, citric acid combination peels or retinol peels, which will gently exfoliate the skin layer by layer and remove the pigment-laden upper layers of the skin, will help to reduce these acne scars. Some of the stubborn black and brown spots of acne can be handled by using the Q-switch Nd:YAG laser skin toning. This is a pigment-loving laser which, when targeted specifically on the post-inflammatory hyperpigmentation of the acne scar, will absorb the laser energy. The pigment particles get shattered and then slowly cleared away by the skin. There are two superficial procedures which do not have a downtime. They are a little repetitive in nature. They need to be performed once in 2 to 3 weeks. These scars, that is the macular rolling scars, the box scars, the ice prick scars, need to be dealt in a more aggressive manner. So laser treatment is the solution to this. There are different types of lasers that are used, but the workhorse for acne scar management is the fractional carbon dioxide laser. Here, there are multiple beams of laser energy which are directed towards the acne scars. This heats up the collagen fibers inside the skin and stimulates the skin's own collagen fibers to slowly form new collagen fibers. We call it neocollagenosis. These new collagen fibers tend to be firmer and tauter, and they gradually begin to fill up the acne scars. So over a period of multiple sittings, usually 4 to 5 sittings, the acne scars get significantly reduced, they look less prominent and can easily be camouflaged. Another alternative to the fractional carbon dioxide laser resurfacing is the microneedling radiofrequency. Here, instead of the laser energy, heat or radiofrequency energy is delivered into the skin. Often, microneedling and fractional carbon dioxide laser resurfacing is combined. This improves the efficacy of the treatment, at the same time reducing the possible downtime of the treatment. So, if the acne scars is evaluated by the dermatologist, they will decide what is the best treatment and in combination how the best improvement can be given. But sometimes none of these procedures will be able to effectively address certain scars that are very deep. For such scars, usually we would like to fill up these scars because we cannot stimulate the collagen fibers of the skin enough to form new collagen to give a favorable improvement. So we use soft hyaluronic acid gels, which are dermal fillers. We inject into the scar, and this instantaneously fills up the hollowing of the scar and gives a more smooth and elevated appearance of the scar. These hyaluronic acid gels are actually natural ingredients of the skin, so they integrate beautifully with the skin's hyaluronic acid and gives a very smooth structure. On the downside, since it's a natural ingredient, over a period of time, they tend to degrade, they dissipate and they disseminate. So it is going to last only for a short duration of time. After the hyaluronic acid gels are actually natural ingredients of the skin, so they integrate beautifully with the skin's hyaluronic acid and gives a very smooth structure. On the downside, since it's a natural ingredient, over a period of time, they tend to degrade, they dissipate and they disseminate. So it is going to last only for a short duration of time. After the dermal filler injections, the scar look improved for a period of about an year. Afterwards, the effect starts getting reversed and a top-up hyaluronic acid filler has to be injected. If one wants to avoid these repeated injections of hyaluronic acid, then a more sustainable material like fat from one's own body is injected into the scars in order to fill up the hollowness of the scars. This lasts for a long period of time, and since it's a natural substance, gives a very smooth and natural appearance to the scars, and the degree of improvement is almost up to 70 to 75%, lasts for more than 5 years. Some of the bigger scars will not be able to be handled by laser, or we cannot fill them up. So they are best if they are excised. So a plastic surgical excision of certain very deep acne scars in combination with filling either with hyaluronic acid fillers or fat would help to give a much more improved appearance. Overall, acne scar treatment has to be holistic. There are so many different types of scars, and in a single person, many types of scars can be present. So depending upon the patient's skin type, the sensitivity of the skin, the grade of scarring and what kind of scars are present, we generally decide which treatment to start off with, how many sessions of a particular treatment to do, and to do it in combination with other forms of treatment. An overall improvement is best obtained by combining all these various modalities of treatment. So acne scar treatment requires patience because it's a long-term therapy, something that does not, we cannot fix it in a short duration of time. All our laser procedures require multiple sittings, and they can be done usually at an interval of 1 month. Overall, whatever deeper scars are left behind can then be handled with filling either with fat or with hyaluronic acid, or certain very stubborn scars can be excised. So by undergoing a combination treatment, the best results can be obtained